Mr. Moderator, fellow town meeting members, the Finance Committee recommends adoption of Special Town Meeting Warrant Article 15, Law Enforcement Clinical Support. The purpose of this article is to fund a regional collaboration with the Dedham Police Department and the Riverside Community Care for social work services. The Riverside Community Care is a regional emergency services program provider that has been designated as such by the Massachusetts Department of Mental Health. The town has multiple emergency services providers. The two that are most prominent are the fire department for fire services and emergency health services, and the police department for emergency protection services, emergency safety services, and crisis services. These are 24 hours a day, 7 days a week operations. In addition to emergency services, both departments do provide ongoing services to residents. However, here we will focus simply on emergency and crisis services. The fire department over the last 50 years has evolved from strictly a fire services department to one that provides emergency health services. There are permanent, full-time 24/7 ambulances that are on call, and firefighters are now trained EMTs and paramedics. The police department, in contrast, over the last 50 years has not changed significantly. And while expected to provide crisis services and community mental health and other types of services, other types of community services, has not seen additions or changes to its staffing. The addition of these social services would significantly enhance the real-time response to calls from behavioral health involved individuals with mental illness and or co-occurring substance use. Having a social worker on call would embed an experienced clinical social worker with experience treating those struggling with addiction into the departments to support police officers in addressing increasingly complex behavioral health needs. And the complexity of the behavioral health needs has increased over time. The goals of this program are to divert appropriate individuals from the criminal and juvenile justice systems prior to the point of arrest into appropriate community-based treatment services and other care options. That goal speaks for itself in that we do not want to incarcerate those who really need some type of treatment or other care. Another goal is to enhance the well-being of residents with behavioral health challenges and their families. The purpose of community policing, which is what we have in Needham, is to help our families. And one way in which we can help that is through social services to enhance connections between local behavioral health, social, and emergency services. This one is self-evident. If we have a relationship with a clinical support services organization, then we will be able to enhance our connection between the police department and those support services. To improve communication and coordination between entities and fill in existing gaps in services. Police officers on their own cannot provide the services that could be provided with this type of clinical support. To ensure responsible use of resources by obtaining appropriate behavioral health staff support, and to train law enforcement officers such that roles and responsibilities are clear and well articulated. We would like to proactively reach individuals and families with behavioral health challenges. This aspect of the services provided would not be an immediate response, but rather a referral from a police officer or the police department to social services based upon the call that was received or a situation that was observed by a police officer when responding to a call. to provide support and resources and prevent the need for critical response when possible, to consistently provide safe, effective crisis response services to citizens with behavioral health challenges, and to train first responders in options that minimize the use of force through training in behavioral health. This last point is a very important point in the current climate that we are facing in the United States. First responders are increasingly coming under close scrutiny for the use of force in situations where perhaps the use of force may not be required. By having appropriate training, first responders would then understand their options and be able to utilize options that minimize the use of force. The results that we seek to see are increasing the number and type of high quality trainings available, supporting the police in developing policies that increase the safety and effectiveness of police response when responding to persons with behavioral health challenges, and ultimately to divert a greater number of citizens from arrest whenever possible. The services to be provided are meeting with family members of struggling minors, assisting with referrals for mental health treatment and support services, responding with law enforcement to calls requiring mental health support. Other services to be provided include outreach with community members to provide guidance in the development of safety plans, to provide crisis evaluation and assistance to community members seeking substance abuse treatment, to increase the number and type of high quality of trainings available. This is a financial warrant article. It provides for $45,000 to be raised from taxes in fiscal year 2022. This is funding for the police department use rather than health department. The finance committee discussed at length whether it was more appropriate to be within the police department or the health department. Ultimately, we determined that the police department is the department that is called in crisis. It is the department that is available 24 hours a day, 7 days a week to respond to whatever emergency need the residents have. The police department is the department that needs these services upon which it will be able to rely in responding to calls. The reason it is a financial warrant article is to allow time to determine the need for the services and the appropriate funding level. For all these reasons, the Finance Committee recommends adoption of Article 15, appropriate for clinical support services for law enforcement. Thank you, Mr. Moderator. Thank you, fellow town meeting members.